According to the American Pediatric Association, 39% of all children who are adopted in the United States show some sign of mental or health care deficit. 6% of those children have passed through the foster care system at least once prior to adoption. Adoption is typically viewed as a time of just sheer anticipation and delight and excitement of welcoming a new child into your home. But what's often not seen is the other side of adoption, the things that happen to the child prior to you bringing them in your home. And what that usually is a lot of trauma. There's a lot of sexual, physical, psychological abuse. This abuse can manifest itself behaviorally. And if a parent is not properly informed or educated on what to look for, these behavioral outbursts or manifestations can look like just what they are, bad behavior. Parents must educate themselves. You must train yourselves and look for signs of how trauma manifests itself. And it can often manifest itself behaviorally. There can be what are called 90-10 reactions, which is 10% of what's going on in the present with the child and 90% of what's past going on with the child. It can also reverse itself and go 90% of what's going on in the present and 10% of what is going on, what's happened in the past. We must, if we're going to adopt, we must learn to look for these signs and learn how to, we must learn how to teach our child coping skills. There are several empirically proven ways to help children who have experienced trauma make it through the trauma and go on to live productive lives and be upstanding, productive pillars in the community. Some of these ways include, 1, parents educating themselves. 2, patience and consistency. Children cannot deny what they see in front of them every day. And if they see consistent parents who are showing them love, they're providing for their basic physical and emotional needs, and there's a baseline of consistency, that is more beneficial to the child than actual therapy and psycho interventions. So that's 2. Number 3 is calling on the support of our community. There are community resources that support groups for families, support groups for children that we should utilize to help. It helps have a support system. It takes a village to raise a child. Oftentimes it's very beneficial to have a pediatrician who is well informed on the symptoms that children manifest to when concerning adoption, and working hand in hand with your pediatrician on how to help your child is another way to help a child who has experienced some sort of trauma. Research suggests that there are in a child's brain that there is a malleability in the cranial contents. In other words, it's saying that a child's brain's plasticity allows for a child to recover more quickly from trauma than an actual adult because of the malleability of their brain. So in other words, the way I like to look at that is we hit potholes, and we hit a few potholes until there's just some smooth sailing. So learning different coping skills. You may have to try several therapists. There's art therapists, rec therapists. There's people who specialize in different ways to help adopted children cope. Play therapy. There's a lot of different therapies, but the biggest therapy for an adopted child is a parent who is informed. A parent who knows how to help assist the child when they have their outbursts, when they have their 90-10 reactions or their 10-90 reactions. Other ways that are proven to help children adjust and start to focus better in school are teachers who are informed. There are special classes for children who have experienced trauma. Oftentimes trauma can manifest itself in learning disabilities like ADHD, emotional outbursts, ODD, which is oppositional defiant disorder, there's several different manifestations that trauma can have with children. So working hand in hand with teachers and finding a class that will help the child is also imperative in helping an adopted child recover from trauma. So a lot of things here. We must educate ourselves prior to adoption. Just know what signs, what manifestations that we need to look for when concerning an adopted child. How can we help this child? How can we call on our community? How can we call on our doctors, therapists, physicians, just to help bring this child to some sort of baseline where they can have a normal life? The American Pediatric Association is an awesome place to look on their adopted children website, just to draw some, just to educate and start to inform. Thank you.